Hey, so I'm Caitlin and I am in NUR 3846 and I want to do my presentation on the philosophy of nursing and what it means to me. So basically this is my take on what I feel like nursing is based off my year and a half experience so far. I believe that each person I encounter matters, no matter their story. I think that each person has a story to tell, and therefore that makes everybody unique. To be able to be a small part of every person's life and to help them through some of the darkest times, it's really an honor. I believe that nursing is about treating the patient, not the diagnosis, and because of that, my care is tailored to every individual. Having love for people should be the core of nursing, the driving factor to always do good. So basically, I feel like, for me at least, I really do feel like everybody matters. I work in a progressive care unit, and I feel like when they come to me, they're really sick and they're scared. And from right off the bat, I want that patient to realize that I'm there for them, that they're not just another patient, they're not like all the rest of my patients, that the care that I'm giving them and the attention that I'm giving them is solely for them, and that I'm there to make things easier, basically. I love getting to talk to patients. I love being a bedside nurse. I really enjoy it. And I do feel like it really is about treating the patient, not the diagnosis, because every patient is different. Just because two patients have COPD, it does not mean that they're going through the same things as each other. I mean, everybody's fighting their own battles. It's not just what the diagnosis is. So I feel like it's important to show that patient that you care. This is my collage that I did. So there's like 6 or 7 images on here basically that I felt for me kind of show nursing in a whole. So in the next slide I'll explain. So my interpretation. To me, nursing is about empathy. I chose the little picture of picking someone up. I feel like to be empathetic is to kind of understand where someone's coming from. I feel like it's one of the sole aspects of nursing because it's really important to be unbiased. Being empathetic just means that maybe you don't agree with the person in the situation, but you you sympathize with what they're going through and you have compassion for them. It kind of says that I'm here to help and I'm here not to judge. So I feel like, at least for me personally, I feel like being very empathetic helps make a lot of situations easier at the bedside. So next, I chose compassion because obviously I feel like to be a nurse, you have to be compassionate. I think compassion is something that you cannot teach people in nursing school. I feel like you just kind of are born with it. Some people are just more sensitive towards others. Some people just show more love and kind of wear the heart on the sleeve as opposed to others. I feel like to be a nurse, you need to be soft and be caring towards your patients. Otherwise, you're not going to have good bedside manner. I feel like it's important for the patient to understand that you actually care about them and not just for your paycheck. Thirdly, I chose Little Heart for Love because I feel like you kind of get into the nursing profession because you like people and you like getting to talk to them and make people better. For me, I'm very outgoing. I love people. I love getting to talk to people. I love everything about the aspect of bedside nursing. I feel like it's important to show my patient that I am a real human being just like they are, and I want to make them feel like they're a real human being. I want them to see that I'm a loving, caring person and that I'm radiating that towards them because if you look good and feel good, then your health usually follows. Next, I chose the house with the money. This isn't really what I feel like nursing is. This is kind of more like this is what I feel like nursing is leaning towards, at least at my hospital. I feel like a lot of patient care is kind of getting put on the back burner because higher up people are focusing more on getting the reimbursements for their hospitals. So, patient safety is kind of taking a back seat and stuff like that. For me, I feel like that's not a good thing, and I definitely feel like money should not be the driven force for this. I feel like it's really important to see that, yeah, it's your job, but you need to love what you do. So, the next one I chose were the shadows. This kind of talks about like mental disorders like depression, anxiety, like bipolar, being manic. This is a huge issue that's going around right now in the world, and I feel like it's something like a social stigma that people are kind of shying away from. Nobody wants to talk about it. Everybody says that they're here for you. If you need to talk with them, when you try to talk to them about it, they run away. So I just feel like it's one of these things where nursing especially that you face a lot. And I feel like it's important that if you have a patient who has any of these conditions, that you need to let them know that that's okay. Um, Everybody has internal demons and everybody is facing problems that they may not know about. So just because a patient comes into the hospital, that doesn't mean that they don't have other things going on that they're worried about aside from like what they're actually in the hospital for. So I just felt like that was important to me because I feel like it's important to show that these things don't define the person, they don't define your patients. So you shouldn't view them like that. Next, I chose education because as a nurse, this field is constantly changing. We're constantly evolving. There's so much new research that we're always learning about, which is one of the things that I personally like. I enjoy learning new things. I love doing hands-on skills. I love being taught new things. I like knowing about the best practices to implement, about new plans of care that we should be doing, just everything. I feel like nursing is one of those fields where you're never going to get bored because there's always something to learn, always something to do. And it's nice to get to share these things with your patients also, like new medications, new procedures, less invasive procedures. I just feel like it helps, like as a whole. I feel like nursing is a great job because of that. Lastly, I chose friendship. So for this one, like I said before, I feel like it's important to establish that relationship with your patient, like at this moment that you meet them. I feel like if you have a good relationship with your patient, then your plan of care for them is probably going to be more individualized. I feel like if you talk to your patient like as an actual person and not as a patient, that they're more able to see you as a real person and talk to you back. I want my patients to know that I'm a friend, I'm here to advocate for you, and that I am here to listen to anything that is bothering you. And I want them to feel like it's an open door policy. Like the second that I walk into the room, they can talk to me about anything. I don't want my patients to feel like I'm just there to get my paycheck and to just give them medications. I want them to know that I really care about what's going on and I want to make sure I do whatever I can to provide the best care for them, get them healthy, make them happy, and let them go home. So I saw this quote and I really liked it. It's from Charles Dickens and it just states, I have a heart that never burdens, a temper that never tires, and a touch that never hurts. I feel like this is perfect for nursing because I know nursing has some positive and negatives to it. Babies are born, people die, things happen suddenly. Some things are great, some things aren't great. I think it's important to know that you just can't take some of these things to heart. You can't hold on to these things because they'll eventually eat at you. I feel like it's also important temper-wise because you do have some patients that just don't listen. You have some patients who really just are not happy and they just take it out on anybody and everybody in their sight. But I think it's important to understand that they're hurting and maybe they can't voice that correctly. And then I think a touch that never hurts. I think it's important to realize that you just need to have a gentle hand and just be kind to everybody that you meet. I mean, that's the best part of nursing. All right, that's it. Thank you.